G'day, Jim.
G'day, Josh.
Good to see you again.
Thanks for inviting an old man onto your study.
Well, thanks for coming and giving me a hand.
Pleasure.
So I saw you speak a couple of weeks ago. You spoke about something called the conversation.
Correct.
What does that entail?
The conversation involves empathy and a genuine concern for somebody, and it's got to be approached in a very disciplined way. And first of all, you've got to be aware that somebody that's close to you is not behaving like they normally do. They're not their normal self. Mm-hmm. So you say to them, look, mate, I love you and I'm concerned about you. For the last couple of months, you don't seem to be your normal self. Can we have a coffee and sit down and have a little conversation?
Yeah.
As I say, in 90% of cases, they will say, yeah, well, things are not going well at home, things aren't going well at work, something else is driving me crazy and I just don't know what to do about it.
Yeah.
And I say to them, look, I'm a Beyond Blue counsellor and I know that if someone's been in a down state for more than 2 weeks, there's an issue, it's not just a minor problem.
Yeah.
And that if you don't seek help, it will get worse. So I encourage you to first of all, seek help, and you can do that by talking to your GP, a psychologist, or you can ring Beyond Blue. They've got a 24/7 call line, and they will direct you after they ask you a few questions to some healthcare professionals that best suit your situation. And then I'd encourage you to follow that process, because I know that nothing changes until you put your hand up and talk about your issues, so that get to the right professionals and work your way through it.
Yeah.
And you will recover.
It takes a certain amount of grit, doesn't it, Jim? A certain amount of grit in order to have those conversations. You've got to be, you've got to show a little bit of courage in order to step up and do something like that.
Well, I find that when people know that you really care about them, they appreciate it.
Yeah, yeah.
Because we don't often say to people in the normal course of our conversations that we really care about them and we love them. They normally respond pretty positively, so get onto the right side of them. They're likely to take your advice.
Yeah. I found as a young person who's kind of going through their 20s, we've replaced our large communities with very, very small communities, or sometimes not at all, where you're communicating just online, but you don't ever meet up with people. You just communicate through technology, and that's the end of it. How important do you think getting together with a group of people is, a community?
It's crucial. When I grew up, we all knew our neighbours. We lived in a very close-knit community. To actually go into another suburb was like going interstate. So it was very much in vogue that you talked and you communicated. I think with the introduction of phones and iPads and all that sort of thing, they just become addictive. And any addiction is an obsession, and it needs to be controlled. It's no different to gambling or drinking or drugs. You need to take a bit of control of it. For me, it's not hard to do because I do that all the time, but the young ones have got to know that for the sake of their own mental health, they need to start having more face-to-face conversations.
Your generation certainly had a lot of resilience. You went through some events that in nowadays we can't even consider the possibility, but I find that maybe my generation's resilience isn't being built because a lot of things seem easy or should be easy. What do you think about that?
Resilience to me is discipline and good habits and repeating them. When I was recovering from depression, somebody encouraged me to take out a blank piece of paper and make a list of all the things I would enjoy doing if money wasn't an issue. And it took me 4 hours to do it, and I came up with 12 things, because what I defined myself as when I was depressed was a provider, and I was no longer providing, so I thought I was nothing. Yeah. And that's the worst thing you can think of yourself. No self-esteem, no self-confidence. So I stuck at this task and I came up with 12 things, and 11 of them were not expensive, things that I really hadn't done before. I started using that as my Bible and referring to it night and day and working through it. I'd never identified life as putting yourself first. Sometimes that can cause a break in a relationship, but what's more important, your mental and physical health or the relationship, if you've got to choose between them? I've done workshops and seminars and I'll say to people, list your weaknesses, and they will just go, 14 or 15. Now I'd say on the other side, list your strengths, and they're scratching their head and struggling, they might come up with one or two.
Yeah.
And I think that's not a good way of being conditioned in life, is it? Because to me, more important now than anything is to identify your strengths and continue to work on them and develop them all your life.
I just want to ask just a broad question. If you could give some advice to people in my generation, just one piece of advice, what would it be?
Find out what they're good at, take control of it, and have mostly fun in their life. Setbacks will occur, but most people, when there's a setback, go back to their old ways of safety. Mm-hmm. The thing is to get back on what your goals are, what you're good at. Continue to do it.
Fun and
it's
goals.
A work in progress.
Yeah, it is. Well, I'm evidence of that. I'm sure I'm going to make a bunch more mistakes.
Congratulations.
Thanks
Jim.
Josh. Appreciate it, mate.